Today's drug is promethazine. Brand names: Phenergan and Promethegan. The pharmacologic and therapeutic class is that it's an antiemetic and a first-generation H1 histamine antagonist. Dosage form and strength. The medication comes as a tablet in a 12.5 mg, 25 mg, and 50 mg strength. It also comes as a suppository in a 12.5, 25, and 50 mg strength. The next dosage form is the syrup, as well as the solution, the oral solution. They both come in a 6.25 mg per 5 ml concentration. And the last dosage form is the injectable solution. It comes in a 25 mg per 1 ml and 50 mg per 1 ml strength. Indications and dosing for adults. A brief note is the intramuscular dosage form is preferred over the IV dosage form when it comes to the solutions. The first indication is for allergic conditions. The treatment range is between 6.25 and 25 milligrams, IM or IV, 3 to 4 times daily as needed, given at meals and at bedtime. The second dose may be given 2 hours after the first dose. The max dosing per day is 100 milligrams. The next indication is for motion sickness. The first dosing regimen is oral. It can be 25 milligrams by mouth twice daily, half an hour to 1 hour prior to travel. The next dosing form is intramuscular, which is 25 milligrams IM twice daily. The next indication is for nausea and vomiting. The treatment range is between 12.5 and 25 milligrams PO, IM, or IV every 4 to 6 hours. For the oral or intramuscular route, the max is 50 milligrams per dose. For the intravenous, the dose is typically around 25 milligrams per dose with a max of 100 milligrams per day. The next indication is for sedation. The treatment range is between 25 to 50 milligrams PO or IM for 1 dose. The max is 50 milligrams per dose. The final indication is for urticaria. The treatment range is between 6.25 and 25 milligrams IM or IV 3 to 4 times daily as needed, given at meals and at bedtime. The second dose can be given 2 hours after the initial dose, and the max is 100 milligrams per day. Indications and dosing for pediatrics. For pediatrics, it's for 2 years of age and older. It's important to use the lowest effective dose and to avoid respiratory depressants, and the intramuscular is preferred over the intravenous route. The first indication is for allergic conditions. The treatment dose is weight-based at 0.1 milligrams per kilogram per dose every 6 hours as needed, with an additional 0.5 milligram per kilogram dose at bedtime. The max is 12.5 milligrams per dose during the day and 25 milligrams per dose if taken at bedtime. The next indication is for motion sickness. The treatment dose is weight-based. It's 0.1 milligrams per kilogram per dose, PO or IM, every 12 hours, initiated half an hour to 1 hour before travel. There is a max of 25 milligrams per dose and 100 milligrams per day. The next indication is for nausea and vomiting. The weight-based treatment dose is 0.25 to 1 milligram per kilogram per dose, PO, IM, or IV, every 4 to 6 hours as needed. There is a max of 25 milligrams per dose and 100 milligrams per day. The next indication is for sedation. The treatment dosing range is between 12.5 and 25 milligrams PO, IM, or IV for 1 dose with a max of 25 milligrams per dose. The final indication for pediatrics is urticaria. The treatment dose is the same as when treating allergic conditions. It is the 0.1 milligrams per kilogram per dose every 6 hours as needed, with an additional 0.5 milligram per kilogram per dose at bedtime. The max is 12.5 milligrams per dose during the day and 25 milligrams per dose when taken at bedtime. Mechanism of action and pharmacology. Promethazine is a non-selective antagonist of both central and peripheral H1 histamine receptors. There is strong alpha-adrenergic inhibition from the blockade of postsynaptic mesolimbic dopaminergic receptors in the brain. In addition, there is also a blocking effect for muscarinic receptors. The various anticholinergic activity is the proposed cause for the medication's sedative and antiemetic activity. The absorption is rapid and complete. The medication is hepatically metabolized via the CYP2D6 and CYP2B6 pathways. It's excreted through the urine and feces as inactive metabolites. The onset of action for the oral and intramuscular is around 20 minutes, with intravenous around 5 minutes. The time to peak for the syrup is around 1.4 to 4.2 hours, with the rectal suppositories around 4.8 to 11.6 hours. The duration of action is 4 to 6 hours, with a max of 12 hours. The half-life elimination for the intramuscular route is 10 hours. Intravenous is between 9 to 16 hours, with suppositories at 16 to 19 hours. The medication is 93% protein-bound. Special populations and considerations. In geriatrics, avoid use due to the Beers criteria. Regarding intravenous administration, this should be avoided, but when it is necessary, extra precautionary steps should be followed, such as dilution in 10 to 20 milliliters of normal saline. Regarding extravasation management, stop the infusion, disconnect and aspirate the extravasated solution without flushing the line, remove the needle cannula and elevate the extremity. Regarding pregnancy, there is risk, caution near term during labor. There is a risk for respiratory depression in the neonate, and the medication does cross the placenta, and platelet aggregation may be inhibited in newborns. In regards to lactation, consider an alternative. There is possible risk of CNS and respiratory depression. Side effects. Some common side effects are drowsiness, dizziness, confusion, sedation, blurred vision, dermatitis, as well as others. Some serious side effects are tissue damage, respiratory depression, thrombocytopenia, agranulocytosis, hallucinations, EPS, photosensitivity, QT prolongation, and others. There is a black box warning for respiratory depression. The medication is contraindicated in children less than 2 years of age. In patients 2 years of age and older, use the lowest effective dose and use extreme caution. The next black box warning is for gangrene and severe tissue injury. Injections can cause severe irritation and tissue damage, and this is regardless of the administration route. In some cases, surgical intervention may be required. Drug interactions. The characteristics for drug interactions is that it's a CYP2D6 substrate, it has anticholinergic effects, there is CNS depression, concerns over EPS, there is photosensitivity, and QT prolongation. Some contraindicated drugs are potassium chloride, potassium citrate, and others. Some drugs to avoid are alprazolam, baclofen, butalbital, carisoprodol, cetirizine, citalopram, and others. Monitoring parameters. Monitor for the relief of signs and symptoms. Monitor for CNS effects such as sedation, delirium, and EPS. Monitor the signs and symptoms of tissue injury with IV or IM administration. Monitor CBC with differentials, and ophthalmic exams are recommended if there is prolonged treatment. Patient counseling information. When given orally, administer with food, water, or milk to avoid GI distress. Promethazine is used to treat allergy signs and symptoms, motion sickness, to ease pain and to prevent upset stomach and throwing up from surgery.